but we have an obligation to get that vaccine out, and we have to get it in arms just as quick as we can.
But after what Governor Mike DeWine called a slow start to the COVID-19 vaccine rollout here in Ohio, there has been progress made in the recent days.
According to the State Department of Health, more than 160,000 Ohioans have received the COVID-19 vaccine. News 5's Jordan Vandenberg is live with a closer look at how it is all going. Hey, Jordan.
Good evening. Officials say that total may actually be underrepresentative of the true number of people who have received the COVID-19 vaccine thus far, because the data often lags behind reality. And despite all this progress made, there is still a long way to go.
There's a moral imperative to get this out just as quickly as we can.
From his bully pulpit last week, Ohio Governor Mike DeWine preached speed, urging health departments and hospital systems to step up their vaccine efforts. Despite the litany of logistical challenges, the engine is now starting to churn.
I think, we've really picked up a head of steam now, and we will exhaust our first, vaccine allocation by Thursday. So we will have vaccinated over 14,000 healthcare workers by Thursday.
The growing number of inoculations at university hospitals is also mirrored in the state's vaccination data. As of December 29th, the state had reported just over 71,000 vaccines had been administered, compared to the 500,000 vaccines that had been distributed. Less than a week later, and despite the holiday weekend, that total has more than doubled to 162,000. Dr. Dan Simon from University Hospitals says the uptick show the infrastructure is beginning to take shape.
We call it around here, go slow to go fast. So you want a deliberate method that gets the glitches out before you open the doors.
From shipping, storage, and distribution, the logistics involved in the largest vaccine drive in U.S. history are nothing short of mind-boggling. Not to mention, those that receive the vaccine have to be observed for 15 minutes after receiving it. It's 30 minutes for those with a history of allergies. Dr. Simon says the most critical component at this point is simply having the vaccine available.
Having vaccine in hand is the critical piece right now. And, the disappointing issue, as many of your readers or viewers have discovered, is that this vaccinating 20 million people by December 31st just didn't happen because there wasn't 20 million doses.
Dr. Simon believes the state's vaccination rollout will continue to gain momentum so long as doses are available. But also an important part of the process, he says, is patience.
It's the beginning of the end, but this is a marathon, not a sprint. We're not going to get to the general population for widespread vaccination until, just as Dr. Fauci said, the June-July timeframe.
And as of Monday's totals, Ohio ranks 7th in total inoculations. Reporting live in Cleveland, Jordan Vandenberg, News 5.